Our daughter was born a month too early with a collapsed lung. They had to perform a procedure on her prior to transferring her down to St. George NICU.
They didn't have all the tools to fully treat and manage a patient with a collapsed lung up in Cedar City, and so Dr. Newman called down to the NICU.
With Piper being here at Valley View and in our nursery, with her developing the pneumothorax, this gave us an opportunity to use the tele-services for the first time.
We were able to collaboratively look at the patient together and walk the team at Valley View through that procedure, where he was able to insert a needle between the ribs and remove the air that was causing her illness.
When I was doing the procedure, Dr. Carroll was actually watching, so that if you take a place like Cedar City where we don't put chest tubes in every single day like they may in St. George, he was standing there watching and giving me suggestions as I was doing the procedure.
I think it's a good thing growing up in a really small town where you don't have a lot of those treatments and things like that available to you. You realize how important they are when the need comes up.
With using the remote systems we have, by having internet available, by being able to share technology, I think it helps us to be able to take care of things earlier, to be more efficient taking care of them, keep babies here in Cedar City that we need to, as opposed to just transferring everyone down to St. George. And it also helps give me the reassurance that if I'm really not sure of what's going on with this baby, I can just turn an internet camera on and Dr. Carroll's looking over my shoulder.
And when we got down there, they were already prepared, had the room ready, everything. They just took her right in and started working on her.
She was only down in the NICU for 4 days. It was nice to have her home a lot sooner than she should have been. We weren't supposed to be able to have children, so this is really a blessing.
The care that Piper received was care that was delivered by an entire staff of nurses and respiratory therapists and physicians across a number of different systems, a number of different hospitals. Without that collaboration, she wouldn't have received all of the different things that she received.
I think it plays a very important part in not only saving the lives of people, but saving my daughter as well.